weapons. Nuclear and radiologic weapons are disseminated with a device, are precipitated by fire or explosion, and, once the radiation is released, cause no immediate symptoms in their victims. Radiologic weapons disperse substances but do not produce a nuclear explosion. Biologic weapons have variable forms of dissemination, produce variable numbers of admissions into the healthcare system, vary in the specific signs and symptoms they cause, and create unusual circumstances. Chemical weapons have a known device, are precipitated by fire or explosion, result in numerous victims, and cause specific signs and symptoms. Disaster planning should be simple and realistic. Healthcare workers should be aware of the disaster plan and understand their role in implementing the plan. There are 4 steps to achieving safety in a disaster. Determine what could happen, create a disaster plan, obtain needed supplies and items for the disaster, and practice as well as maintain and update the plan. Also, healthcare providers should create a safe environment during all phases of disaster planning. In determining what could happen, consider terrorism. What areas are at high risk? Highly visible areas, heavily populated areas, sporting venues, telecommunication sites, manufacturing and testing centers, historical sites, and agricultural areas. It is imperative that communities establish a committee to prepare for terrorist attacks and other disasters. Members of the committee should include representatives of emergency response agencies, the Emergency Management Office, federal and state agencies such as the Federal Bureau of Investigation, hospitals and other healthcare facilities, the Public Health Department, and the medical examiner. There are 3 stages of a community's response to a disaster. The first stage is the pre-disaster or pre-impact stage. This stage includes identifying potential disaster risks, vulnerability analysis, resource inventory, prevention and mitigation, and public and professional education. This stage also includes planning, warning, pre-impact mobilization, and evacuation. Pre-impact mobilization is action aimed at averting the disaster or minimizing its effect. The second stage is the impact or response stage. This stage includes damage inventory, rapid assessment of injuries, rescue and immediate care of victims, and remediation or care to meet victims' needs. It also includes search and rescue, first aid, emergency medical assistance, restoration of communication and transportation, public health surveillance, and evacuation. The last stage is the reconstruction or recovery stage. This stage includes restoration or reestablishment of a basic way of life, reconstitution or returning the community to normal, and mitigation that includes future-oriented activities to prevent subsequent disasters or minimize their effects. In the event of a natural disaster or terrorism, there must be initial evaluation of the scene, the delivery method, and the physical characteristics of the disaster. Victims must be assessed, triaged, and decontaminated as needed. Decontamination can be done indoors or outdoors, but it is preferable to decontaminate at the scene. The triaged victims should then be transferred to the hospital for treatment and follow-up. Disasters result in a great deal of stress for the victims, their families, the community, and also the healthcare providers. Healthcare workers must protect themselves in the event of a disaster or act of terrorism. They should minimize their contact and use personal protective devices, including respiratory protection. Responders who come in contact with the contaminants might also require decontamination and treatment. Community leaders should perform a community risk assessment to identify threats and targets, note geographic location and distribution, available resources, equipment and trained responders, and the nearest site for hazardous materials treatment. They should assess the healthcare system that serves their area for capability of potential client load, called surge capacity, disaster or response plans, and surveillance systems. The community and healthcare systems should be integrated to provide for maximal community preparedness. The United States government has established a Homeland Security Advisory System that defines 5 levels of alert: low, the green level; guarded, the blue level, elevated, the yellow level, high, the orange level, and severe, the red level. Terrorism preparedness plans should address all of these levels. Even at the green level, there can be unanticipated acts of terrorism. Now let's turn our attention to evaluating clients' needs in their everyday lives. You'd mobilize several resources for this, starting with the United States Department of Health and Human Services. Government resources include the Centers for Medicare and Medicaid Services, the Administration for Children and Families, the Social Security Administration, and the Administration on Aging. These divisions provide support for basic needs with funding based on meeting eligibility criteria. Voluntary, non-governmental programs such as the American Cancer Society, the American Diabetes Association, the American Lung Association, and the American Heart Association often have local chapters with available resources or referrals. A community health nurse assessing a community to identify its needs can complete a windshield survey. This assessment involves traveling throughout the community to obtain objective data about the community. Components to observe for while conducting a windshield survey include community boundaries, housing and zoning, signs of growth or decay, parks and recreational areas, businesses, transportation, healthcare services, schools, citizens, churches, and protective services, including police, fire, and ambulance. You can also interview and survey citizens to gain more information about the community and its potential and actual problems. Talk with families as well as educational, governmental, economic, religious, recreational, safety, communication, transportation, healthcare, agriculture, and industry sources. Once you've identified the needs and the resources, how do you make appropriate referrals? Community resources are available at the national, state, and local levels, both governmental and private. Determine the specific services each provides to clients, families, and the community. Identifying resources is time-consuming and takes considerable effort and patience. However, you will have to become familiar with the types of services offered, eligibility requirements, and costs. You can share this information with other nurses, prepare and provide materials, make initial contact for the clients, and arrange transportation. Vulnerable population groups are people who are more likely to develop health problems as a result of exposure to risk or to have worse outcomes from these health problems than the population as a whole would. Vulnerable populations are at risk for poor physical, psychological, or social health. Factors that make people more vulnerable than others include poor physical health, few material resources, and few non-material resources such as psychological and social resources to assist them with coping with illness. Special populations that are vulnerable include the poor, medically indigent, homeless, pregnant during adolescence, terminally ill, abused, substance abusing, and severely mentally ill community dwellers, as well as those who have communicable diseases such as HIV infection or STDs. Another resource you've heard about is hospice. The purpose of hospice is to provide support and aid for people at the end of life so they can live as fully and comfortably as possible. The hospice philosophy affirms life and considers dying a normal process. A terminal disease is one that progresses to death, while dying is the final stage of living, with a physical shutdown of the body processes. Maintaining quality of life includes adequate pain control, basic nursing care, nutritional considerations, assistance with elimination, and emotional support for clients and for families. Hospice services are available 24 hours a day, 7 days a week. A hospice team takes an interdisciplinary approach, with various members working together: nurses, physicians, nursing assistants, social workers, dietitians, physical and occupational therapists, and clergy. The hospice team also includes volunteers who help support the terminally ill